Published 2119 EDT, the 30th of October 2017. Updated 2124 EDT, the 30th of October 2017. If a child ends up in hospital, it was once most likely to be due to a bumper scrape they had while playing. But children under 10 are now twice as likely to be hospitalized with tooth decay than with a broken arm. The problem is blamed on a lack of awareness by parents about how to care for children's teeth and their failure to take up free NHS dental treatment for under 18s. The number of under 10s admitted to hospital for tooth decay in Indiana, 20167, topped 34,000, meaning youngsters are twice as likely to be hospitalized for that than a broken arm. Picture posed by models. Consumption of sugary drinks and foods could also be to blame, as 90% of tooth decay cases are avoidable. In 201,617, there were 34,205 cases of under 10s needing hospital treatment for tooth decay, according to figures compiled by the Royal College of Surgeons, Faculty of Dental Surgery and the Press Association. In contrast, there were only 17,043 cases of arm fracture, NHS digital data showed. Other common problems leading children to need hospital treatment included asthma, with 19,584 cases, epilepsy, with 10,397 cases and 3,805 cases of appendicitis. Children with tooth decay can require treatment in hospital if they need general anesthetic to have teeth removed or if the decay has caused other issues which require more complex surgery. Professor Michael Esker, of the RCS Faculty of Dentistry, said no one wants to see their child in hospital. Sometimes this can be unavoidable, but when it comes to admissions caused by tooth decay, most cases are a result of simple preventative steps not being taken. Overall, for all children and teenagers aged 19 and under, there were 45,224 cases of hospitalization for tooth decay. It is now the most common reason that children between the age of 5 and 9 need treatment in hospital. There were 25,923 cases in this age group last year, up from 25,875 in 201,516. There were only 17,043 cases of arm fracture, NHS digital data showed. The figures also revealed there were 19,584 asthma cases that required treatment. Picture posed by models. Hospital admissions also rose among 10 to 14-year-olds, from 7,249 to 7,303. There was a fall in the number of young children aged 1 to 4 treated, dropping from 8,800 in 201,516 to 8,281 in 201,617. But the youngest patient treated was less than a year old. Analysis by the faculty earlier this year found nearly 4 in 5 toddlers aged 1 or 2 had not seen a dentist in the previous 12 months. Parents are advised to take their children to the dentist when their first milk teeth appear, and dental appointments remain free on the NHS until they are 18 years old. Professor Esker added tens of thousands of children every year are having to go through the distressing experience of having teeth removed under general anesthetic. Labour's Steve McCabe, who is leading the debate, said the figures were pretty frightening. Reducing sugar consumption, regularly brushing teeth with fluoride toothpaste and routine dental visits will all help ensure this is avoided. The problem is compounded by the fact that many children are simply not going to the dentist, with parents often unaware that NHS dental treatment is free. He said children could be put off seeing a dentist for life if their first experience involved having to have teeth removed under anesthetic, so regular checkups were important. MPs will discuss child oral health during a Westminster Hall debate tomorrow. Labour's Steve McCabe, who is leading the debate, said the figures were pretty frightening. He added this is an almost entirely preventable condition. Apart from the fact that this is costing the NHS rather a lot of money, it is clearly not very healthy for our children. It would appear that there are a mixture of factors involved. It's partly sugar in the tea, but it's also the lack of visits to the dentist, and this is possibly parental ignorance about the need and also some doubts about what dentists will provide for free. The British Dental Association's chair of general dental practice, Henrik Overgaard Nielsen, said these shocking statistics are rooted in an abject failure by government to tackle a preventable disease.